Hello, my name is Leticia Salazar, and today I will be explaining the study of epilepsy. But before we get into the facts, I want to first tell you why I chose this topic. I chose this topic because my mother has had this disease most of my life, and there's not a day I don't think about how my mom's doing, or if she's okay, or if she's taken her medication. Now getting on with the overview. Epilepsy is a chronic brain disease which causes repeated convulsions in the body, and sadly the most common disease. The brain's electrical rhythms become imbalanced, which result in recurrent seizures. Epilepsy affects over 3 million people in the U.S. and 50 million worldwide. More than 300,000 children are affected under the age of 15, and more than 90,000 young people have seizures but aren't treated. A person with epilepsy is more likely to have mental health issues, which includes anxiety, depression, or suicidal thoughts and behaviors. People who have had epilepsy will have it the rest of their lives. All people need to do is keep taking their medication or it will result in a seizure. One time my mom accidentally missed the dose and she ended up having a seizure. Epilepsy is a global disease, meaning all sexes and ages can have this disease. But the chances of men are more likely to get the disease later due to age or having a stroke. Going back to people will have it the rest of their lives, there are some treatments that you can get, but there are certain types of seizures that you have to get a surgery that will get rid of your epilepsy. The background I found is this disease has been a factor of human life dating back to ancient time. The long history has been traced back to 4,000-year-old Akkadian tablet that was found in Mesopotamia. What the tablet said was a descriptive writing on what a seizure looks like. National Library of Medicine states that his neck turning left, hands and feet are tense, and his eyes wide open. From his mouth, froth is flowing without him having consciousness. I put the disease of the tablet that they were talking about, but here's a little caption that I wrote. This is the Akkadian tablet, and it was organized into 6 chapters. Tablet 26, which is this tablet, is the chapter describing epilepsy and the different types of epileptic presentation. The possible causes I found were genetics, head injury, forming tumors, a stroke, infections, parasitic infections, and mothers who are pregnant that can have poor nutrition or not enough oxygen. People with autism are more likely diagnosed with epilepsy as well. Fun fact, about half the people in the world have no identifiable cause for having epilepsy. From genetics, that run in families, certain genes tend to make a person sensitive to the environment and any factors that impact him or her. A head injury or trauma, brain needs protection at all times. Forming tumors in the brain or the way blood vessels form in the brain. A stroke also may be a leading cause in adults older than 35. As I said, infections like meningitis, HIV, or inflammation in the brain, also known as viral encephalitis. The triggers I found are use of alcohol, flashing lights, prohibited drug use, skipping doses of anti-seizure medications or taking more than usual, sleep deprived, stress, dehydration, and skip meals. The medications I have found are Keppra and all these other ones that I can't not pronounce, but the ones that my mother has taken are the Keppra and this one and this one. The major systems it impacts are the cardiovascular system and the respiratory system. Now, the major organs that it impacts are the brain, heart, abdomen, and spinal cord. The other system it impacts are reproductive system, muscular system, and the digestive system. Now going on to the anatomical and physiological changes. When epilepsy occurs, there are both anatomical and physiological changes in the brain that occur. Parts that are affected in the brain are the hippocampus, amygdala, frontal cortex, temporal cortex, and olfactory cortex. And these areas take up a big part in the memory and processing emotions and so many other qualities that affect your everyday life. I wrote this down because I want people to be more educated on what to do when you see a seizure in real life. So when it comes to seeing a seizure in real life, there's nothing you can possibly do to stop it. But all you can do is let the person just go through the seizure while making sure they are safe and comfortable. And you can try and lay them on their side because it's a less risk of them choking on their tongue, while also timing the seizure, because if the seizure lasts more than 5 minutes, it can be fatal. So immediately dial 911. And in my opinion, it's best to get CPR training. I've got it, and it's taught me so much more. Now moving on to the different seizures that occur. The temporal lobe seizures may include an odd taste or buzzing ears, panic, or deja vu. The frontal lobe seizures, and I had put this picture in to get a general understanding on where the lobes are and where they occur in the brain. But the frontal lobe seizures that begin here may cause loss of motor control and change in behavior and language. The occipital lobe seizures can cause a person to see multiple colored shapes like circles and flashes. Some people experience temporary loss of vision. Parietal lobe that can cause a person to feel numbness or feel of burning or cold sensations. I had split these up because these are different types of seizures, and these generalized seizures are less common than the focal seizures. So if you have these ones, these are more intense. So the absent seizures, also known as the petit mal, these seizures may cause rapid blinking, loss of focus, or you can stare into space for a few seconds or minutes. The tonic-clonic seizures, also called as the grand mal seizures, these may cause jerking of muscles and maybe a cry out or foaming out of the mouth. These focal seizures, this one, the simple focal seizure, can affect a small part of the brain and have minor symptoms, either a small twitch or a strange taste in the mouth. A complex focal seizure involves multiple parts of the brain. Confusion occurs. People may be disoriented or unable to respond for seconds to minutes. A secondary generalized seizure began as a focal seizure in one part of the brain but progresses to a generalized seizure. And these are just the descriptives of what I'm saying here. The tonic are muscles stiffen. The atonic are muscles going limp. The myoclonic are quick jerky movements, and the clonic are repeated periods of shaking or jerking movements. And then, as I said, the focal seizures are more common than generalized seizures. And then I just put these as to see where the focal seizure is and the generalized seizure and now it's more prominent than the focal seizure. Here I just uploaded a picture of a normal brain scan and an epileptic brain scan. And I wanted to put this video to show you, to educate everyone on what a grand mal seizure looks like.
Brain can like trigger it to disturb.
We have a little miniature spirograph that we take in the car when we drive. You know what a spirograph is? It makes little designs. It's like a gear. You put your pencil in holes in it, and anyways, it makes all kinds of designs. Why don't you guys go out? Because the nurses are going to be coming in. Hi. Not a problem. He generally vomits after.
He does? Okay.
Yeah.
Okay.
And he quite often loses bladder control.
Okay.
So.
So as you can see, when his seizure stopped, the repeated convulsions in his body stopped. And I also forgot to mention that when you go through a seizure, your eyes tend to roll back too. The complications of a seizure can affect moods and behaviors, major depression or anxiety, and also there can be a sudden unexpected death. Person is most often found dead in the bed and don't appear to have a convulsion seizure. Possible cause may be problems with breathing or heart rhythm or brain function that occur with the seizure while they are sleeping. Sleep issues can include sleep deprivation, make sleep disorders worse, and medication can cause issues as well. Thinking and memory is the temporal lobe seizures mainly that have problems with memory, language, and thinking. Your bone health can also be affected because anti-seizure medications put people at a higher risk of developing osteoporosis and fractures, particularly with older medications, not the newer medications. The key findings I found are, depending on what specialists find, treatments can be surgery, constant medication, or devices such as the vagal nerve stimulation, deep brain stimulation, or responsive neural stimulation. Potential disturbance in sensations such as taste, hearing, or vision. Uncontrolled muscle movements such as jerking, as I mentioned. In some case surgeries, it is an option. It just depends on what type of seizures a person has. Some of them can be treated, some of them can't. I had put this in here because this is my mother. We have been through a hospital round, so we have to go through a hospital for a week while she has this EEG on her head, and they put her through seizures while flashing lights in her face. So the hypothesis that I had made for this one is, if the doctors can flash lights in my mom's eyes, then they will track with the EEG to where in the brain the seizure is happening. This will give them insights on what types of seizures she has, so they can be treated. The last one we had went through, they didn't find exactly what she was looking for. She had more of a focal seizure that time. My mom has had different seizures every time a seizure occurs. It's so weird, but she's still getting treated and she still needs to go for more rounds at the hospital. But that is my mom, and I put this guy in here because you couldn't really see what was on her head, but this what was on her head. And the week that we were there, she couldn't take it off. They were always monitoring her brain. And these are all my works cited. Thank you.